Welcome to Charge Passing training for physicians, mid-levels, and clinical staff. Before we start, I'm going to review some key points in regards to charge passing. The first extremely important point is that all charts must be pulled from the appointment schedule in EMR. If a provider attempts to sign off on the chart and it was not pulled from the appointment schedule, a yellow triangle and error message will appear in the sign-off window stating that this encounter cannot be billed electronically. If this happens, the provider must cancel out of the sign-off screen, go back to the appointment schedule, and double-click to pull the encounter from the schedule. The second point is in regards to documenting in the assessment and plan. All orders and procedures that you want to bill for must be ordered in the assessment and plan. All orders and CPT codes must reflect the actual provider or the ordered for provider on the order. The ordered for provider can be edited within each ordered code by right-clicking on the CPT code, selecting Edit, and changing the ordered for field so that it reflects the proper ordered for caregiver. This also may be defaulted to the appointment caregiver under caregiver customizations that we will review at a later time in the training. The final key point is that you must use valid diagnosis codes. All labs and procedures must be linked to a valid diagnosis code, and only system-delivered diagnosis codes should be used. If a SNOMED or a free text code was used, that code will pass to the PM system, but no diagnosis code will pass along with it. An error message will also appear during the sign-off. The billing status will need to be changed, or a different lab procedure with a valid diagnosis code will have to be chosen. Next, we will discuss documenting in the assessment and plan. For clinical staff documenting, an ordered for caregiver must be selected for each code. In order to do that, you can either select the procedure, right-click, and select Edit, then update the ordered for field in the procedure order screen. You'll notice that mine defaulted to the appointment provider because that's set up under my caregiver options, which we will discuss later on in the training. If this needs to be changed or is listed incorrectly, I can click on the drop-down and select the correct provider. For this case, I'll leave it as the appointment provider and click OK. It's important to verify that the provider is ordered for provider is listed correctly under each code. You'll notice that under my AST, my ordered for is blank, so I'll click on the drop-down and select Dr. Del Grippo, then click OK. For appointments that are not scheduled with a provider, such as immunizations or nurse visits, the ordered for caregiver will need to be changed. For providers that are documenting in the assessment and plan, if the provider is the only one ordering in the assessment and plan and signing off on their charts, no extra steps are required other than to make sure that everything is properly documented. And finally, it's critical to make sure that the diagnosis codes are listed in the order of priority. The primary reason for visit should be the first diagnosis code listed. Once that's finished, we're ready to proceed to the history and physical screen. However, there are some exceptions for mid-level chart reviews and sign-off. The first thing that we'll discuss is the billing level. At the bottom of the assessment and plan window, there is an option to select the billing level. For mid-levels, because the chart may need to be forwarded to the provider for review, selecting the billing level here will allow them to have that default when they come back through to sign off when the chart is sent back to them. To change the billing level, if the default is not correct, you would click on billing level and update the window here. For this purpose, I'm going to leave it as an office visit billable and leave my billing level as the site default. Once this is done, I can click OK And the mid-level should always confirm that all orders are listed and are correct in the assessment and plan window and that the billing level is correct. Once they're finished, they can proceed to the History and Physical screen and click on Submit to forward it to the provider for review. The physician will then review the chart and select Send Back to forward back to the mid-level to sign off on. The mid-level will then select Sign Off and submit the encounter for billing. When clicking on the Sign Off, the encounter type and the billing level will default to what was selected on the assessment and plan window. The physician should not review and sign off the chart. If the physician reviews and signs off the chart, it will create a duplicate encounter in the billing system. After reviewing the chart, the physician should always hit the Send Back button to return the encounter to the mid-level provider for sign-off.